Welcome. Today we will going to see the next disease that is in the respiratory system. Disease of the respiratory system, that is asthma. Okay. Now I will share the screen. Is it visible? See, now respiratory disease, asthma. Asthma means what? Actually, it is a respiratory disease. It is a common pulmonary disease. Asthma is a common pulmonary condition characterized by chronic inflammation of respiratory tubes. Respiratory tubes, that is the respiratory tract. Okay, respiratory tract. If there is any inflammation, like always we are suffering from the common cold. If this condition exaggerates, if this condition triggers, then if it persists, then it causes more inflammation of the respiratory tract or respiratory tubes that causes a tightening of the respiratory smooth muscles. Tightening of the respiratory smooth muscles, that is spasm, that we called as a spasm, and the episodes of the bronchoconstriction, and due to that, due to contraction, due to constriction of that smooth muscle, that causes the tightening of the chest, tightening of the respiratory smooth muscle. You can tell, you can say anything, okay? That is called as a bronchoconstriction. That is called as a bronchoconstriction. This is known as bronchospasm. This is known as bronchospasm. Are you understand? Now, during an attack of asthma, actually this attack of asthma, it takes place early in the morning or at the night. Okay, when the environment is too cold, when the environment is too cold, that's why this asthma attack takes place will at the morning, early in the morning or night. Okay, but daytime, how it is? It is the environment is sunny, that's why not having any problematic. During an attack of asthma, inflamed airways react to the environmental triggers. Which triggers? Causes, that is the smoke, dust or pollen. So many. It is also increase the disease related to environmental pollution. Later we will see what are the etiology of this asthma, what are the causes. Okay, so what is the main thing? If inflamed airways, if the respiratory tract is inflamed, if there is any type of inflammation is there, due to what? Due to environmental pollutions. Which type of pollutions? May be smoke, may be dust, may be pollen grains, may be home dust, any type of the person, the individual is having any type of allergy, then this is, it causes the asthma. It is a condition characterized by episodic airflow obstruction due to bronchospasm. Why the condition? Why this condition persists? Because of this respiratory tract, whatever the tubes are there that are constricted, Why that are constricted? Due to the contraction of the smooth muscles, bronchial smooth muscles. Okay, so what happened? There is a constriction, so it causes the spasm. there is, if the air is, there is bronchoconstriction, then there is a narrowing of the respiratory tract, isn't it? The tract will be narrow, and that causes the obstruction to flow the air. There is an obstruction to flow of the airflow. So it causes the bronchospasm. The condition exhibits short or long spells or breathing difficulty along with the dyspnea, wheezing, and cough. And due to that, it causes short or long spells of breathing. Short or long spells of the breathing difficulty. It means what? Difficulty in the breathing, in simple language. It causes what? Difficulty in the breathing. Along with what? Dyspnea. Dyspnea means what? Difficulty in breathing. Dyspnea, this is the medical terminology, means what? Difficulty in breathing. Wheezing, that is the sound it produces while respiration. There is a wheezing sound. Wheezing means that is a sound, and maybe cough due to what? Obstruction of the flow of the air. So what happened? Coughing may produces. Okay, this is all about the introduction of the asthma. Introduction of the asthma, that is the respiratory disease. It is common pulmonary condition characterized by chronic, it is due to the chronic inflammation of the respiratory tract. That due to what? Due to bronchoconstriction, due to bronchospasm. Due to that, what happens here? What are the main causes? The environmental pollution. And due to that, it causes obstruction to the airflow. Obstruction to the flow of the air, and that leads to dyspnea, breathing difficulty, difficulty in breathing, and produces wheezing or cough. Now see the types of the asthma. Depending on the etiological factors, it is classified into 3 types. We will see next the etiology. But before that, we will see the types of the asthma. 3 types of the asthma are there: extrinsic asthma, intrinsic asthma, or mixed. Maybe extrinsic or maybe intrinsic. Now we will see extrinsic asthma. It is also called as allergic type or atopic. Or intrinsic asthma means what? Idiosyncratic or non-atopic. And third type, that is the mixed type of asthma. Now we will see one by one. Extrinsic asthma. Extrinsic asthma, it is a common type of asthma in the childhood or in the early adult life, in the early age. This causes, keep in your mind that this is the common type of the asthma when it takes place in the childhood, or we can say that early in the adult life. It is caused to inhalation of variety of allergens. Means what? This is mainly due to the allergy. Due to the allergy. Which type of the allergy? Any type of the allergy. Some are having allergy, some are not having allergy. Some are having the allergy due to what? Such a dust, house dust, pollen grains, animal dander, molds, fumes and gases, organic and inorganic dust, any type of the allergy, Okay, so some are having, some are not having, but keep in your mind that is the extrinsic asthma means what? It is mainly in the childhood. It takes place mainly in the childhood, or we can say that early in the adult life. Now see the intrinsic asthma, non-atopic or idiosyncratic. This type of asthma usually develops when beyond the age of the 40 years. Beyond the age of the 40 years means after 40 years, this intrinsic asthma will take place. It is caused due to many other causes than allergens. Means it is not due to the allergy. It is not due to the allergy, but other than the allergy. Means what? That other causes means what? Which are responsible for asthma are cold, exercise, emotional stress, occupational, drug-induced, nocturnal asthma. Other than these are not due to the allergy, like the above this one extrinsic asthma. But this one is due to cold. If the cold persists, if we will not treat properly, if it will persist, then it lead to may exaggerate, may trigger to the asthma. Okay. If we will do more and more exercise, that is also limited one. Okay. Due to the exercise, asthma is also there. And the emotional stress, due to emotional stress. See, one thing we observed, if we are crying loudly, then what happens? We can't inhale properly like that, isn't it? So this is the emotional stress. If we are more happy, then also, and if we are more sad, then also, that is the emotional stress. Occupational, due to occupation, any type of that leads to allergy, that leads to means not only the allergy, this is one type of allergy. Yesterday we seen that one in the COPD, isn't it? Occupational. Maybe the individuals are working in the chemical industry, that mines, isn't it? Other industries that causes, that chemical causes the occupational, this one, asthma. In drug induced asthma, due to the drug, some of the drugs that also causes the asthma. And nocturnal asthma, some are having at the night, means due to extreme cold or due to the night, sun is not there, isn't it? So due to that, the environment is cool, cold is there, that's why this is, some are having this type of asthma, nocturnal asthma, night asthma. Okay. Night asthma. Some are having difficulty in breathing in the night time. You may be observed that one, isn't it? So this is the extreme intrinsic type of asthma. Understood this one? Extrinsic and intrinsic. What is the difference between that? Extrinsic means actually childhood asthma, and intrinsic above the 40 years, and extrinsic mainly due to the allergy, and intrinsic may other than the allergy, that is the other causes for asthma, that is the cold, exercise, emotional stress, occupational, drug induced asthma, nocturnal asthma, isn't it? Now see the mixed type of asthma means maybe intrinsic, maybe extrinsic. Many patients do not fit into either of the above two patterns of the asthma, not intrinsic or not extrinsic. They have mixed features of both types of asthma. Means both, means that individual is having, we can't differentiate, maybe intrinsic or maybe extrinsic. The patient develops the asthma in early life have allergic causes. Okay, whereas who develops the asthma in the late life have no allergic causes. In the early life, maybe due to allergy, and when the patient, when the individual grown up, not having the such type of allergy, isn't it? Maybe due to the other, that is the intrinsic. Okay, so not differentiated, so this is called as a mixed type of asthma. Understood this one? Two, three types, that is the intrinsic, extrinsic, and mixed type of asthma. Now we will see the etiology. So many etiology you can write your own way also. Okay, don't by heart this one. Okay, only the side heading you have to keep in your mind, that is the physiological factors. What come under this one? Physiological, that is the respiratory infection such as common cold. Okay, heavy physical activity, exercise induces the asthma. Heavy, if you are doing too much heavy exercise, physical activity, then there is a difficulty in breathing. Due to that, this is called as a heavy physical activity, that is the exercise induced asthma. Certain medications, that is the when you will go to the next year, that is the second year, you will have the one subject that is the pharmacology. Then you will understand the drug induced. What do you mean by that one? Okay. Now just keep in your mind certain medications, due to that drugs, including which type? Beta blockers, aspirin, ibuprofen. These causes the asthma, strong emotions and stress. Okay. Untreated conditions such as rhinitis, sinusitis, gastroesophageal reflux. If we will not treat this one, rhinitis, inflammation of the respiratory tract, the sinusitis, the sinus problem is there. If we will not treat these inflammations, gastroesophageal reflux one, if we will not treat these conditions, then may lead to asthma. Menstrual cycle in the women, hormone, due to the hormonal changes, also causes this type of asthma. Okay, these are the all the physiological factors. Due to physiology, come under the physiological factors. Next one, that is the common indoor environmental irritants and allergens. Which are those one? Indoor, our house, the pet fur, feathers, pet urine, saliva, dander. Some are having the hobby to that is the dog, cat, isn't it? And they are uh, because of that fur, that feathers, that urine, saliva, dander. Some of the individual having the allergy, others are not having, isn't it? So that is the common indoor allergens. Perfumes, isn't it? Air fresheners, incense stick, scented candles. Some are having allergy of this type also, isn't it? Tobacco smoke, wood smoke, house dust, cleaning solutions, pesticides that come under the agriculture, pesticides, isn't it? And the paints, fumes, yesterday we seen agriculture, that is the pesticides. Paint fumes, cockroaches waste, cockroach in house only, isn't it? If will not clean, then that will causes the allergy. Not all, but some of the individuals, some of the individuals. Next one, these are the common indoor. Okay. Now common outdoor, this we seen indoor. Now outdoor, we will see outdoor the airborne allergens such as pollen grains, animal dander, mold, cockroaches. They are also having outside, and dust mites, exposure to the cold air, extreme cold air, hot humid air, changes in the humidity environment. If it will change, it triggers to the asthma condition, isn't it? Asthma attack. Air pollutant too much is there, isn't it? Irritants such as the smoke, vehicle smoke is there, industrial smoke is also there, fumes are there, isn't it? So many air pollutions is there. Sulfides, preservatives added to some types of the foods. That's why we should tell that we are should not eat outside or preservated food, because if we have to if the food, if we have to preserve, we have to add the preservatives, isn't it? So we should eat the fresh one. We should eat the fresh one. And beverages, you are having no that one. Coca-Cola, what are those one? Sprite, isn't it? Dried fruit, processed potatoes, wafers, beer, wine. Some of they are the allergy, having the allergy. Now see that these are all about the outdoor. Okay, indoor, outdoor. Understood the difference? Now, food allergy, some are having the specific type of the food allergy. If they will have, the aloo sabji. Aloo means not potato, that is the green vegetables, aloo. Some are having the irritation in the throat, isn't it? So, this is one type of the food allergy. Okay, food allergies involves the body's immune system. reaching to the proteins found in the food. Okay, some of having the food allergy, specific type of. So this is all about the etiology. What we see in physiological factors, in that we see in the common cold, exercise induced asthma, drug, certain medications, means drug induced asthma, emotion, stress, untreated some diseases, menstrual cycle in women, that is due to the hormonal changes, common indoor one and common outdoor one, and other that is the food allergy. Now we will see the pathogenesis of asthma, how the asthma takes place. Now see, very simple simplicity I given here, that is the schematic representation. Afterwards we will see. Now see this one, the allergens upon exposure stimulated the production of antibody IgE, that is the antibody. Okay, when we will attack to, when we will expose to the allergy or allergens, when we expose to the allergens, then what happen? Our body will produces the antibodies. Okay, stimulates the antibodies IgE, which further binds to the mast cells. Okay, which further binds to the, this IgE binds to the mast cells upon exposure, upon re-exposure. First time we expose, and then what happened? Again we will, if exposed to that type of the allergy, means re-exposure to some allergens, the said allergens readily binds to the IgE and results in degranulation of the mast cells. And what happens if the mast cell degranulation breaks? Then they releases certain substances which are bronchoconstrictor in nature. Which are those one? Histamine, leukotrienes, prostaglandins, isn't it? Which when the mast cells degranulations breaks down, then what happens? They releases certain substances. Which type of certain substances? Histamine, leukotrienes, prostaglandins, isn't it? These are the bronchoconstrictor. Okay. These released substances are again responsible for inflammation, bronchial asthma, and enhances the mucus secretion, increases the mucus secretion, which collectively results in severe obstruction in the respiratory tract due to that bronchial spasm, bronchoconstriction, inflammation, due to the deposition of the heavy mucus that will not causes the flow of the air easily. There will be obstruction in the flow of the air, and that causes the, again exaggerate the disease, severe condition. In the response to above changes, what happened? WBCs migrate into the area to engulf the foreign material. If all these things, then who are our soldiers in our body? WBC, white blood cells. They migrate into that area where the attacking takes place. In that area where the inflammation takes place. Why they will come? To engulf the foreign material, that is the allergens. Okay, this phagocytic reaction causes release of basic proteins, which are lytic agents for tissue that further promote the inflammation. See, one by one that are damaging. If again that one phagocytic reaction, that is the, when the WBCs come, due to that phagocytic reaction, they release the basic, while that type of the reaction, they releases the basic proteins that proteins are lytic agents, lysis, that is the breakdown. And again that type of that tissue will damages. And yesterday we seen that one, isn't it, in the COPD, the alveoli, the covering of the alveoli, that will be swelling, the alveoli will be swelled, isn't it? The septa will be breakdown, isn't it? The tissue will be further damaged, and that causes the inflammation. And again, it will exacerbate the condition. Okay, now see here. This is all about the theoretical. Now see here, you will understand nicely in the schematic representation. See, exposure to the stimuli. Stimuli means what? Allergens for a specific type of the stimuli. Okay, then what happen? Our body will produces the antibody IgE. Okay, and this antibody causes what? Attacking to the mast cells, and these mast cell releases vasoconstrictor and inflammatory substances. That is the which are those? Histamine, leukotrienes, prostaglandins. These are which type of? These are having the nature vasoconstriction and inflammatory substances. Is released by the mast cells when the mast cells are degranulation. Okay, then this causes the inflammation and enhance the mucus, increases the mucus. This due to this inflammation. If there is any in our body in any type of the any area, if there is inflammation, our soldiers means who? The WBCs, mainly the neutrophils. Okay, migrate these cells. Which type of cells? These are phagocytic in nature. लड़ाई करने वाले. Migration of the phagocytic cells, that is called as a phagocytosis, isn't it? And this during that time they releases the basic protein that are lytic in nature, breakdown in nature. So further it precipitates the asthma again. And this due to the inflammation, due to the increased mucus, the airway narrowing and obstruction is there in the respiratory tract, and that will also lead to precipitation. Means both type of this one causes the precipitation of asthma. When the attack, it produces, our body produces the antibody, release the release the substances by the mast cells which are having which type of the nature? Vasoconstrictor and inflammatory, and that causes the inflammation. Due to inflammation, it enhances the mucus secretions and causes the narrowing of the respiratory tract or respiratory tubes. Okay, and that causes the obstruction in the airflow, and that leads to precipitates the asthma. And here, due to that inflammation, who will come? WBCs will come. That causes the phagocytosis, and during that one, it releases the lytic proteins or enzymes, and further that will leads to precipitation of asthma. This is a very simple way. Okay. Now see the clinical features or signs and symptoms. What are common? That is one. If you know the common cold, it is very easy. The same condition, that is the exaggerated one. Coughing, it worsens at the night. Why at the night? Because the environment is too cold in the night, also in the early morning also, making it uneasy to sleep. Making it uneasy to sleep. If we are continuously coughing, then can we sleep? No, we also not sleep, and the others also will not get sleep, isn't it? Shortness of the breath, difficulty in the breath. Now, chest tightness or chest pain is there due to the continuous coughing. Pain is there, obviously. Itching on the chest, trouble during sleeping, caused by the due to what? Due to shortness of the breath, coughing, or wheezing. A whistling or wheezing sound, that is the rhonchi during the expiration. Asthma, actually, this is the characteristic condition, isn't it? Rhonchi means if we will, the sound like whistling. When if we will whistle, then how the sound produces? Like that same sound will produces while expiration, not in the during the inhalation, while expiration. You know that one, in Marathi we called as फोंकणी असते, फुंकडी. चुलीमध्ये आपण फुंकतो ना एक अशी लांब घेऊन. आता कोणी चूल पेटवत नाही, त्यामुळे यू विल नॉट अंडरस्टँड दॅट वन. बट इफ यू आर villagers, then you understood that one. When the air will blow, if you will blow the air, then that sound will produce, isn't it? That is the whistling sound. That, like that type of the whistling sound will come, isn't it? The whistling or the wheezing sound that we called as a ronkai, that we called as a ronkai. Okay. And excess of mucus production, coughing, wheezing attacks at the worsened by the respiratory virus such as cold and flu. Coughing or wheezing attacks that are worsened by will due to the virus. Nowadays the corona is there, no, due to the virus and or as a cold and flu. Okay. In severe attacks, now this is all about the mind, but when the attack is very severe, that time what happens? More exaggerate the condition. Shortness of the breath becomes severe, creating a state of anxiety, fear, isn't it? Agitation and sweating due to fear, due to anxiety, maybe agitation, sweating, because no, if we are not taking proper air, means that is hypoxia condition, that time we will anxiety like anything, fear like anything, isn't it? So in the severe attack, there may be there are the chances of, not the chances, definitely, that is the shortness of the breath becomes severe, too much. We can't take the air, we can't inspire. Okay, we can't take the air inside, inhale. So that's why it causes a state of anxiety, fear, agitation, sweating. And at the end of the attack, at the end stage, last stage, wheezing may diminish as hardly any air is moving in and out of the lungs. No air is inhaling or out exhaling. Okay, completely stop the breathing. The individual stops the breathing. Severely reduce the oxygen supply. No any oxygen. So what happened? That leads to confusion, that leads to lethargy due to no oxygen. In the case of, that is the hypoxia, blue skin coloration. Due to that oxygen, only the red color is there for our blood, isn't it? So our skin will also become blue, that we called as a cyanosis. And the pulse rate more than 120 per minute. Okay, agitation and need emergency treatment. What here we need? Oxygen supply. Okay, so we can save the individual. This is all about the signs and symptoms. Severe attack and end stage understood. Now see the diagnosis. How we can diagnose? Common diagnosis. That is the physical examination of the patient. If you will go, what the doctor will see? Physical examination, examine the nose, throat, upper airway with the help of the stethoscope. They listen the breathing sound, wheezing sound, whistling sound, bronchi, isn't it? Examine your skin, signs of the allergy conditions such as eczema, hives, isn't it? So many things are there that they will examine. Okay, the doctor will examine. Spirometer test means what? Here we examine, here due to this test we can measure the expired air, largest expired air. What happened there is the spirometry is there. With the help of the apparatus we can measure the forced vital capacity. Okay, the vital capacity, the total capacity of the lung. Okay, and the forced expiratory volume we can check with the help of this type of the apparatus. And challenge test here. Now if this spirometry test, if we will observe normal, then what? The next, try to trigger the asthma symptoms by inhaling the methacillin. If the individual is normal with this spirometry test, then again if you are doubtful, Then again, the methacholine we will given for that patient, that individual, and that due to that methacholine, that drug, cholinergic, actually this is the cholinergic drug. This methacholine causes the bronchoconstriction, narrowing, and this spirometry test we will do repeated, and if the spirometer measurement again it will come normal, then we say that the person is not having asthma, okay. If this test is come negative, normal, in this case again we have to do for the further investigation. If we were doubtful, then we have here giving to that patient, inhaling that patient the methacholine, okay. This causes the narrowing of the respiratory tract, and again we will go further this test, spirometry test. Again we have to measure the forced expirative volume. Again, if it will come normal, then we can definitely say that the patient is normal, not having the asthmatic patient. Okay, not having the asthma. Now, next one, that is the allergy test. Allergy test. How we will do? Skin testing or blood testing can be used to confirm this type of test. Okay. Exhaled nitric oxide test. Here, what happens? Actually, nitric oxide, it is produced in our body. But if it produces high quantity, then there may be inflammation. So we will do here the exhaled nitric oxide test. What we have to do, patient breathe into a tube connected to the machine. Okay, that measures the amount of the nitric oxide gas in the breath. Nitric oxide, it is produced in our body normally, but high levels in the breath indicate the inflammation of the air. If you will breathe into that machine, that machine will measure the nitric oxide gas. If it is more than the normal, then definitely inflammation is there. Mucus sample test, with the nowadays corona is there. That's why in the mucus testing is one of the tests, one of the diagnostic tests, isn't it? So here also in common respiratory tract, in common respiratory diseases, we are testing the mucus sample. Okay, if the mucus can be tested for the signs of the airways inflammation, if any type of the inflammation is there, virus or bacteria are there, infection is there, viral or bacterial infection, we can check. And the other so many laboratory investigations are also there. Okay. Like that the proteins are released by the phagocytic reaction, that will also we can check in the laboratory. Okay. And then other test, diagnostic test, that is the X-ray examination, blood examination, sputum examination, isn't it? So many tests are there. Which are those one? Physical examination, spirometry test, challenge test, allergy test, exhaled nitric oxide test, mucus sample test, laboratory investigations, X-ray examination, blood examination, and sputum examination. So many laboratory, that is the diagnostic test are there. Okay, this is all about the diagnosis. Now see the treatment. So here, simple one, keep in your mind. If bronchoconstriction, we have to give the bronchodilators, isn't it? The exactly opposite, that is the treatment. In the treatment, what we will give? Bronchodilators. 2-3 drugs you have to keep in your mind. These are the drugs, short acting beta 2 receptor agonist. These drugs dilates the bronchi. Xanthine drugs, theophylline, these also causes the bronchodilation. Okay, anti-inflammatory drug, if there is inflammation, give the, to relieve that inflammation, we have to give the anti-inflammatory drugs. Some examples are there: prednisolone, methylprednisolone, hydrocortisone, okay, beclomethasone. These drugs inhibits the inflammatory response of the asthma. Others are also there. Promoline sodium, it is anti-inflammatory agent. Again, inhibit the release of inflammatory mediators from the mast cells. Mast cells releases that one, no, leukotrienes, heparins. So these releases, it inhibits these type of the drugs, inhibits the release of that inflammatory mediators. Leukotrienes modifiers, that is the preglucose, it blocks the synthesis of leukotrienes. Okay, so many drugs are there. This is all about the treatment. Bronchodilators, anti-inflammatory drugs, okay, chromoline sodium, leukotriene modifiers that blocks the synthesis of leukotrienes. Now prevention. It is very easy. You know the etiology, so how to prevent, you know that one. If according to that etiology, we can write the prevention. Dust-free house, avoid the triggers and allergens, improved ventilation. Ventilation should be proper, isn't it? Use the air conditioning, but filtered one. Okay. Avoid the extreme exposure to the cold condition, medication before heavy exercise. Okay, intake of selective food material. If you are having some type of the food allergy, then avoid that one. Okay, complications. If the condition exists, persist chronically, then further complications causes. That is the signs and symptoms which interfere with the sleep, work, and recreational activities, other activities, okay, other activities while toileting, while washing, while changing the clothes, isn't it? So many things are there. Permanent narrowing of the bronchial tubes, creating difficulty in breathing. Sometimes the muscles will be spasm like anything. That is a permanent narrowing of the bronchial tubes will take place. Okay, difficulty in that causes the difficulty in breathing. Severe attacks of asthma can be medical emergency leading to hospitalization. Okay, severe attacks, you have to hospitalize the patient because they will give the external supply of oxygen cylinder they will supply, and so that the patient can save, we can save the patient. Adverse effects of the long-term use of the anti-asthmatic drugs need to individual approach. So many drugs are there. If you will take continuously, that will also having the side effects, isn't it? The ADRs are also there. You will see in next year, that is in pharmacology. Okay, this is all about the complications. Sometime the heart will also having in giving the problem. Due to that, if everything is if no water, we can save. Okay, if no food, okay, let it be. But if no air for a few seconds also, that is very danger, isn't it? So all the systems will damage like anything, isn't it? So these are the complications. Understood this one, asthma? Now we will close here only today's asthma. Okay, understood this one? I will stop here only.